heart and then kind of massage it. So that'll drain the fluid and it'll also help open up your chambers a little bit better. And I'm pointing the major blood vessels like away from me so that it doesn't just like splatter out on me. So just massage it. And then I just wanted to orient you guys to the directionality. So there's a couple things to look for. First of all, the shape of the heart is kind of like an upside down pyramid, and that'll help you remember the names of this superior portion, which is actually called the base, because it's kind of the base of the pyramid. This is the apex. So you have a base, an apex, even though this is the superior, this is the inferior. And then to define anterior versus posterior, what you want to look for are these, which are a portion of the two atria, but when you're looking at them from the outside, you call them the auricles, which are like ears. So these are the ears of the heart, and the way they tell you direction is that they reach forward. They reach towards the anterior face of the heart. So if you're seeing them curving towards you, you know you're looking at the anterior portion. So this is our anterior. The white, so this is all adipose tissue of the sheep. And then you're also seeing, as Ernest pointed out, so these tracks are defining or showing where some of the coronary arteries and cardiac veins flow, basically. So once you define anterior and posterior, you can realize which side is going to be the left and the right, but we also will be able to diagnose that once we open it up. So right now we know this is going to be the left, this will be the right, but it'll be very obvious when we open it too. So take your scalpel, and the way that you want to cut it after you've massaged it is you want to start at the apex, and you want to also cut along the right side. So we're going to open up the right chambers first. And we want to open them kind of like a book. And just cut carefully, not to cut yourself. You're also welcome to try the knives for this to make it a little bit easier. So once you make the first cut, you can kind of start opening it up. And actually, I am going to cut through the left side as well. Sorry, I got distracted and I didn't show you guys the major vessels. So a couple of major vessels, before you cut into it, you want to start to see if you can identify where the vena cava and the aorta are. So basically, let's look at that once it's open. It'll be a little bit easier to tell definitively. So I flipped it over, I'm cutting through the left chambers. So then, at that point, you can open it up. I think my choice of instrument is not doing me any good.
Can you not slice yourself? That's the last thing we need.
I know, that would be terrible.
Careful.
Yeah, it's it looks like a piece of chicken.
Ew.
Yeah, I would recommend you guys use the knives, actually. Okay, so this is kind of when I was thinking of opening it like a book. A lot of times you can open it and still have like these two portions connected, but we just opened it. And a couple things to point out, like landmarks on the inside. So the septum is dividing the right and left chambers of the heart. That's the big piece of myocardium in between. And speaking of that, you can also see like the myocardium surrounding the entire heart. We called the outside the pericardium. The inside surface facing the inner part of the heart where the blood is flowing is the endocardium. So endo, myo, peri. And you can see here what I was talking about with the most amount of myocardium surrounding the left ventricle, where it has to be the strongest. versus the right chambers are very small in comparison. So to actually find where the vena cava is, you can basically, once you've identified where your right atrium is, feel free to just use your gloved hands and like feel around. And so basically, I know blood is entering my right atrium from the vena cava. And so you can then diagnose, okay, this is my vena cava, at least the superior vena cava. The inferior is a little bit harder to find on these, but identify your superior vena cava. And so you know the oxygen poor, CO2 rich blood enters the right atrium through that. It's then going to go through the tricuspid valve here. And so one thing to point out, actually, you're seeing a lot of fibrous structures. So these are, the fibers are called chordae tendineae. And that's where people originally got the term heartstrings. These are the heartstrings. They actually regulate the opening and closing of the valves, of the two AV valves, the atrioventricular valves. So the blood is going to pass through that tricuspid valve, go into the right ventricle, and then let's see if we can, this one's sometimes trickier to find how it exits to get to the pulmonary. So it's at an angle in your body, and so I am confident that this is the atrium, but then I think the path that the blood follows to get out through the pulmonary trunk, I'm able to feel it through this side, and it almost seems like it's going through the atrium as well, but I think that this vessel is the pulmonary trunk and it's connected to the right ventricle. And so you can see the other part of your finger coming through, so that would identify your pulmonary trunk that would branch off into the left and right pulmonary arteries, go to the lungs, get